Hi everybody, this is a video about an incongruence between test results on a person versus test results on their home when it comes to mold. Just before I jump into the video content, if you enjoy my videos, please consider liking this, sharing it, subscribing, following, depending on which platform you're watching this on. Just helps to bring more attention to my channel, and if you find my information to be helpful, then more people can access it if they know about it. So thanks in advance if you're able to do that. So somebody posted a comment on one of my other videos. It wasn't actually a question, but I wanted to post a video about it anyways because it's something I've seen in my practice a number of times, and I think that folks who have complex chronic illness, especially if there's a mold component, might find this to be useful information. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. Please talk to your personal healthcare provider about medical advice. So the comment, if I'm paraphrasing correctly, was that the individual said they tested as positive for mycotoxins from their body, so presumably it was a urine mycotoxin test. So that came back showing, yes, there are mycotoxins here, and yet the person indicated that their home has been tested a few times and they can't find any mold in their home. So what is the possible explanation there is something that some people might wonder if they had those seemingly incongruent findings. So there's a few possibilities, and every case is going to be a little bit nuanced. One thing to consider is what are the actual level of mycotoxins in the person's urine sample. There are certainly some patients where it seems like some people just have low levels, especially in my experience anyways, of ochratoxin, which is made by Aspergillus. And if it's just a fairly low level, then it might just be a bit more of an incidental finding. There are also some clinicians who and researchers who feel that mycotoxins that come up in the urine could potentially be a reflection of how much of whether a person's been eating food that has some elevated mold contamination. Much of the food that we eat has at least a little bit of mold, because unless you're getting it fresh, eating a raw cow or something like that, there's going to be an opportunity for some tiny bits of mold growth to occur. Now, there is some compelling evidence to suggest that dietary intake mold does not impact urine mycotoxin levels, but to my understanding, that hasn't been definitively proven one way or the other, which is why with my patients, I always recommend they do a mold, they try to avoid commonly moldy foods as much as possible. Of course, you're not going to eat, nobody's going to eat moldy bread as a rule, but certain foods are stereotypically higher in molds, like melons or fermented foods or aged products or things like that. So there is that type of explanation that maybe it's a bit of a false positive or a red herring with the positive urine mycotoxin test. However, assuming that's not a factor, and I've had a number of cases where that has not been the factor, other possibilities could be that the mold exposure came from a different past environmental exposure. What's really unfortunate is that mold, if one is in a moldy environment for long enough, sometimes those mold spores will actually colonize the sinuses, and then when the individual leaves that environment, then they bring the mold with them. And that is unfortunately a thing that comes up all the time. I've had many patients who are like, no, I'm in a new home, it definitely isn't moldy, it's been tested, blah, blah, blah. And yet they have clear signs of mold toxicity. And with their history, this is of course not every case, but I've had a number of cases where it's a very clear history where, yeah, I worked in that old musty smelling building, I developed all these symptoms, I developed fatigue and brain fog and all these sinus issues, started getting respiratory tract infections all the time. As a side note, one does not have to have all of those symptoms for it to be mold toxicity, but with a history like that, it's pretty much a slam dunk history that we're probably going to find mold if we test for it, and hopefully the patient's going to feel better if we treat that mold. So in cases like that, sometimes they were in that moldy environment 15 years before coming to see me. They stopped working there 10 years prior, and yet they still have symptoms. And yeah, that person's going to test positive for their urine mycotoxin test, and yeah, their current home is probably, hopefully, going to test negative. So we can have past exposures, and unfortunately bring that mold along with us for the ride for years and years, or I've had some patients where it's been decades. It's also, of course, possible that one could have an exposure not at their home. I've had a number of patients, teachers, like many teachers actually now today, probably at least a couple of dozen, where their mold exposure, as best we could tell, was from working in an old school that had history of water damage. And there's some schools in the province where I practice, beautiful Nova Scotia, Canada, that schools have been closed, needed to be closed because of environmental contamination like that with mold. So the exposure could have happened or could be happening from another place, or it may be a past exposure. So just a couple of possible explanations as to why there might be that incongruence with those test results. So again, nobody actually asked that question, but I hope that this information is useful for some folks out there. If you have any questions about this topic or anything else, just post in the comment section below and I'll do my best to answer as soon as I can.